What about gastritis?
Are you one of those who eat salsa with tacos instead of tacos with salsa? If your answer was yes, well, you should watch this video. And if it wasn't, you should also watch it.
Did you know that whenever you consume very spicy or irritating food, you're exposed to a lot of diseases related with your digestive system? One of it is very common nowadays, and I'm sure you've heard of it. It is called
Gastritis.
Let's get intellectual.
We must know the concept of gastritis, that refers to the inflammation or irritation in the stomach lining.
Just to give you an idea, 7 out of 10 Mexicans are affected by this disease. So imagine how popular it has become and how quickly it has expanded.
But how or why does it appear? Let's review its causes.
You can get gastritis by eating spicy or irritating food in great quantity, drinking a lot of alcohol, smoking constantly, by the intake of certain medications, by surprisingly stress, and by the affection of a bacteria called Helicobacter pylori, containing contaminated water or food, and responsible for the 90% of the cases of gastritis in Mexico. You may be wondering, or not, that if gastritis affects many, how could you know that you're not suffering from it? And to answer, it's not that hard. Check it out, its signs and symptoms. A main manifestation is a very strong pain in the stomach. Others are derivates from stress as a cause, such as a headache, nausea, and vomit. If you're still not sure about this, there's a process known as endoscopy, where with an instrument, doctors can examine the interior of the digestive tract, determining the presence of the disease. It is essential to begin a treatment when you have been diagnosed of gastritis. If the patient allows gastritis to develop, first he will obtain a gastric ulcer. Then there will be bleeding of the tissue, and there could even be a perforation. This health state refers to the illness in an advanced process of development. We must take steps to recover our initial health, eliminating or controlling our disease with the use of a treatment. From ranitidine, omeprazole, and pantoprazole to aluminum and magnesium hydroxide gels. But it is
Very important.
not to self-medicate, because the constant intake of certain medications for gastritis can cause other negative effects. During adolescence is when most cases of gastritis are present. A recent study showed that 75% of adolescents suffer from it. We know it is a stage with a lot of changes in our body, and also with the things that surround us. One of the main causes of gastritis is stress, as we mentioned, but in this case is due to social problems that include school, responsibilities, and relations. So now we have the required knowledge about gastritis.
Wait, but how can I make it not to suffer from it?
Oh, that's a very important point. To inhibit the risk of having gastritis, we must follow the next steps. Being informed by us can be considered an initial prevention. If you know the information of the disease, you have the power to do something to prevent it. Reduce the levels of stress in life. There exist many therapies that can be very efficient. Acquire healthy diet habits, avoiding spicy and irritating food and beverages. Quit alcohol and smoking. They do not help your stomach and your body at all. Do not eat food when it's too hot. You could damage yourself. Try to eat slower and smaller meals. Maintain a healthy weight. That would be all, folks. Now you know how to prevent it. Help yourself by following all these advices.